Hi guys, so obviously we always talk about when it comes to back rehab, the best thing to do or the way to find a solution is to answer the question, it depends. What's the best thing to do? It depends. So let's have a look at an example of what we mean by that, because I think a lot of people misinterpret what that means as it's just kind of like a vague statement, that'll work for one person but not the other. Realistically, what we're actually trying to do is understand why one particular exercise or approach is going to work for one person and isn't going to work for the next. So let's have a look at that sort of example within the realms of sciatica. And let's look at two different types of sciatica. So we can have a discogenic sadaka, which is classically what people think of when we talk about sciatica. So someone's got a disc bulge or herniation. When they move into flexion, they obviously compress that disc. They force the nuclear fluid out towards the back. That then presses on that nerve root. It gives them that sensation down one of their legs. When we move them out of flexion, it should cessate a little bit. And if we put them into some controlled extension, they should actually get a little bit of relief because it will pull that bulge, that herniation, back into that disc a little bit and take that pressure away completely. Now, it'd be easy to look at that and say, that's going to work for everybody, but it doesn't. So again, those familiar with the work of Professor Stuart McGill, and also those familiar with the work of Robin McKenzie, we understand that will work for disc bulges. So putting people into gentle extension will kind of reverse that pressure and help the disc bulge to heal. However, again, if you're familiar with the work of Professor McGill, we can also have stenotic type sadaka, whereby the actual nerve, the channel that the nerves sit in the vertebrae, they might have got some sort of arthritis or some inflammation in there. Could be from the bone, could be from ligaments in that area, whatever it may be, but they're closing up around that nerve and then making that gap a lot smaller, and that's giving you that sciatic pressure. Now for that person, the reverse is probably going to be true. So if you put them into flexion, which would be worse for a discogenic sadaka, if you put that person with stenosis into flexion, they might actually get a bit of relief. And if we put them into extension, what's going to happen is we're going to close that gap and make it worse. They'll feel worse with things like disc recovery position and trying to restore some extension to their spine. So again, when we talk about it depends, we need to understand what we're dealing with exactly, and that then dictates what we're going to do going forward. Now, there's things that we can do to save that guesswork. So again, if you're familiar with the work of Professor Stuart McGill, we've got two very useful tests. So for discogenic problems, we can test flexion intolerance and see if that sets off that sadaka. So we use like a slump test. If I put someone into that position of flexion, especially when they add compression as well, that should basically turn on or make their sadaka pain worse, almost like a light switch. And the second we move them out of that position, take away that compression, it should start to settle down. And then when we put them on the floor, or if I test them in a standing extending position, they'll feel better and actually feel a bit of relief from it. However, someone with stenosis, if I put them into the slump test, they're going to get no change, like them it's going to feel irritated. But the second I do like a standing extension with them, and particularly if I bring them to one side maybe versus the other, that's going to light up that sadaka and give them their pain symptoms back. So then between those two cases, I can see very clearly they need to be treated almost in the opposite way to each other. So compressed flexion with discogenic sadaka, we can start working on things like passive extension, that will help them feel better. The person that's got stenosis, that's going to make them feel worse. So I can't use those tools because they're exactly the wrong thing to use for that person at that time. So again, when we think about the idea of, it depends, what do I do for my back pain? Well, it depends. We need to hear exactly what we're dealing with first of all. And again, that's where a thorough assessment will come in handy. So let's actually see what's actually going on. So even in the realms of sadaka, there's different reasons why someone's got that pressure on that sciatic nerve. We need to know exactly why it's there and what type we're dealing with. And then we can start to propose solutions and exercises and strategies to get them back on the right path and let things recover. So again, what's the right thing to do with back pain? It depends. And before anyone can propose any solutions or exercises, they need to know exactly what they're dealing with and better tell you exactly what you're dealing with and why we're going to use a particular approach or an exercise or routine, what it means for you, and why we're doing it that particular way. So as ever, the more accuracy we get with that thorough initial assessment, the better results we'll get, and the less mistakes you're going to make as well to irritate things. So as ever, investigate what you're dealing with first of all before you start proposing solutions.